and I was on my own. I worked in the banking sector. Just जैसे हम Indians होते हैं, we study, we do exams and we go on. So I created a place for myself in the banking sector. I was in the media when I was here, but there in 2007, I was heading the NRI, non-resident Indian services for HSBC Bank for the whole northern region. I was flying high, life was good. Good fun, yes, but health. I got diagnosed with endometriosis grade 4. I mean, I don't know how much you know about it, but people even reaching there, I don't know how people reach there without treatment, but I managed to do that. I was told to call my family. I had a surgery. I was out for 6 months from work. The reality of the world hit me. I started, it was very, very hard because then you realize you are vulnerable. There is no support because we ran away, remember? No family, nobody there. All my friends were here, new community. And I remember IFA. IFA happened in Leeds, Sheffield in 2007. I was supposed to get all the Indian Asian crowd. Unfortunately, Leeds is a very white area and most of the population is Bangladeshi and Pakistani population, whom I knew through my banking. And of course, Indian community is not so strong. I could not supply them with people. We had a good time, but I was very busy having a surgery and recovering, which sort of really shocked me. I decided to come out of it, change my life. This was July 2007. I decided let's move on. Every time something drew me down, I always thought, let's get on, do something else. I thought, chalo, let's change the bank, let's change the job, let's do something else. Subsequently, I was also undergoing IVF because I desperately wanted a child. The doctors told me that because of the situation, medical condition I have, we should work towards it. I changed my job. I joined Barclays Premier. I don't know if you're aware. They also own the football team. The clients in my portfolio were footballers, movie stars. It was an amazing life. Matching car, matching uniform, good life. This was July 2008. I just joined Barclays 1 month. I was going for a conference on the way. And there was a poster saying, please check your breast for breast cancer or anything. We have loads in UK. So I just touched, while looking at it, and I felt a lump. And I thought, it's not possible. I've just come out of a life-threatening illness, just recovered after 6 months of off, starting my new life. I'm looking forward to a child and new career. And I mean, it's just something just like that. Immediately my GP immediately called an ambulance. Usually in UK the system is very different. When you get diagnosed, you have to go to your general practitioner. And the practitioner will book an appointment and then the consultant will call you. It's a long process. But for me it was very strange. I walked into the GP just like that and she just said, go to the hospital straight away. And I was like, how do you even know? Because even if you have cancer, there are lots of tests, as the doctors know, to diagnose it. Anyway, lucky or not, I was taken to the hospital, tests were done. 10 days they gave me to tell me the verdict of my life. I was like going on with it, doing well, carrying on, because there were no symptoms. Nothing. I was healthy, I was happy. 10 days later, the consultants called and said that please come with a member of your family and attend an appointment. Well, there is no member of my family. I lived in this village. It was a village called Oulton. You just saw the village church signage. So I lived in that village. It was a white village, elderly population. And when you are young, at my age, nobody can, my friends can't take you because they are all working. They are all busy. So only the ladies, the elderly ladies of the village who were retired would take me. So one of the ladies accompanied me to there. And there were about 4 or 5 consultants sitting. Long story short, they told me, there are 3 cancers in your breast. Because you were doing the IVF treatment, you're very lucky. It was hormone receptive, it was detected. Later on we found out the one which was detected was not the harmful one. There was a smaller malignant cancer which had spread. I was diagnosed between stage 3 and 4, and I was told you have basically 8 months to 1 year to live. And my whole world just went for a toss. I had no insurance, my job, I just joined new, there was nothing to protect me. My parents had just gone back, especially my mom, who's amazing with her strength, had just gone back from the previous surgery. And he said immediately we have to do surgery, chemo. I don't even remember because the light flashed in front of me. From that moment onwards, it started. How long will I live? How long will I live? I remember my consultant talking to me 8 months into the treatment, that saying that why you bother about all this? You're a banker. Go for a holiday. I said, where's the money? Well, you work in the bank. Use a credit card. I said, fine. He said, where do you want to go? I said, I would love to see America. Anyway, long story short, I went to America thinking, well, at least let me do what I like to do in life. I completed my 8 months with a program which they specially created for me, where they could not give me the normal tamoxifen and all. I'm talking about 2008, it's a long time back. As the doctor said, there are new medications, new treatments now, but it was horrible. I cannot explain, I cannot go to the depth of what you feel when you have chemo. It kills you, basically. They talk about caps, and for a person like me, as you can see, I was from a media background in Delhi. I was doing, as I told you, how much well. Did anything help? No. Nothing helped. To report, or anybody to say that, listen, I'm in the hospital getting treatment, or my chemo is going on. Nobody knew anything, so I dragged myself to the office. I even got some of my chemo treatments in my office, in my cabin. As time went through and I was waiting when will the death sentence arrive, I survived. I went on. And when I survived my 1 year, fighting with the banks, didn't know what to do, being made redundant, had no insurance, no family. I just want to tell you guys this, even if you want to run away, please plan it. Plan it. Family is very important. For women especially, we need to think. Because we are not alone. We have to think about our parents, we have to think about our children, we have to think about our family. Who will support you? No one. It's only your family who will do things for you. And I had gone away from my family. It was quite hard. Once I completed my 1 year, I actually went back to the banks and said, why didn't you tell me that there was insurance, there were arrangements, if you get ill, you need to do this. I spent 9 years in banking. They said, well, it is a qualification of a financial advisor, a term they used, who is extremely qualified, who does not work in a bank, who deals and advises on insurances, on long-term planning, on sickness. And I thought, well, here I am, being redundant in the hospital, going to an office where people don't even know who's coming, going. Everything was in turmoil in UK. I decided I want to do that. If I survive, I want to be that. So next 2 years, I did my exam. I had 9 surgeries. Lots of them were reconstruction, and they tried everything on me as I lived on. I became a financial advisor and joined a new job in 2010. All my hair was gone, and in 2008, North UK launched Young Women's Cancer Support Group. It's very important to see, it's not only cancer. Cancer can happen to anybody. The important thing is which stage of life you are at. I was young. It not only affected my income, there's no money coming in, nothing. I still had to pay my mortgage, I still had to get on with the life and trying to keep alive. Unfortunately, there is no support from my partner. And that is where it comes in. When you go through a turmoil, you need to understand, you need to have a family support, which maybe you cannot plan, but you can at least think about it. And cancer does not come with a knock, nothing. Today I'm living with a long-term illness. I'm 10% in the whole world to survive. In the meantime, I did my exam, I joined another bank in a senior position, tried to advise and tell people how important it is to plan your life, to plan your financial journey, and protect your health and protect your family. I was told by the hospital then, who was